Chris Morris. Now, it is a medical first. A woman in India has received a new drug to prevent excessive bleeding after childbirth. The condition causes over 70,000 deaths a year around the world. And until now, the first choice treatment needed refrigeration to store and to transport it. Not this one, though. Let's talk to the doctor who administered the first dose last week, Dr. Shiva Prasad Gudha, who joins me live now on the programme. Thank you so much for being here with me. Just how important is this milestone, do you think?
Matthew, this is a historic moment in the global maternal health initiative. We have a new drug that can be administered to women delivering anywhere across the globe without the need for refrigeration. This is a landmark event for all of us.
Give me an idea of the scale of the problem with excessive bleeding in childbirth or after childbirth globally.
Yeah, around the world, every year, more than 70,000 women die during childbirth, and about a third of them die because of postpartum hemorrhage or excessive bleeding after childbirth. So it's a huge problem, and more than 14 million women experience excessive bleeding after childbirth. So if we can give a drug to them to prevent postpartum bleeding, I think we would have a game changer on our hand.
We're seeing pictures as you speak to us of the first woman who received this dose that you administered. Tell me a little more about her.
Yeah, I mean, we were part of the trial that tested this intervention, and it's great to have the product in use now. The first woman received the drug. The safety profile is as good as oxytocin, the current gold standard, and it's now being made available at a cost equivalent to that of oxytocin. So I think we have a win-win situation for the mothers and for the healthcare providers.
And tell me a little more about how much a game changer is the fact that you don't need refrigeration for this particular drug. And you talked about the cost there. Tell me also about what you anticipate in terms of the availability worldwide and the timeline on that.
Yes, the drug was approved by the Indian Drugs Controller last September, and within 8 months, the company has been able to ramp up the production and make it available to the market. And they have a commitment to make it available globally in most of the countries in the very near future. So they are going in for regulatory approvals in most of the countries. And so it should be available fairly soon. And in terms of the cost, as I said, it's the company has made a commitment to make it available at a cost on par with oxytocin. And if you take out the cost of cold chain maintenance during supply and storage, I think it will come down to even lower than the current cost of oxytocin administration.
And how much of a problem is refrigeration at the moment in so many different places of the world? Does it mean that essentially that the drug that is available at the moment that needs to be kept much cooler, is that only available in big cities?
Yeah, actually, it is a huge problem, and there have been a lot of studies done in many countries which show that the quality of oxytocin that is administered to women is substandard, as well as the potency is not there when actually it is administered, because most people are not even aware that it should be in cold chain storage. So I think this is a huge step forward in that sense.
Well, Doctor, it's good to talk to someone involved in such groundbreaking treatment. Thank you so much for joining us here live on the programme.
Thank you so much.